Welcome to the Fewell Homestead YouTube channel. My name is Amy Fewell from thefewellhomestead.com. Today we're talking about the herbs you need, the best antiviral herbs that you can find. Maybe I'm a little bit biased. I'm sure there's others out there, but we're going to go over them, especially for cold and flu season coming up and for the most recent virus, which we will not name in this video just in case YouTube wants to take it down. So if you have not subscribed yet, make sure you do that for more herb videos that I have coming out over the next few weeks and well into fall and winter. We also have an herbalism course coming up that you will want to learn about when enrollment begins, which is probably going to be the end of this year or beginning of January. And a lot of you are new subscribers already, so thank you for being here. A lot of you came over from the viral video that I did a few weeks ago talking about ways to prepare this fall and winter with food storage and herbs and various different things for life with the most recent novel virus in this year. So I wanted to add at the beginning of this video that this is in collaboration with my friend Anne from A Farm Girl in the Making. She has a video coming out today too about food storage and how she's preparing on the West Coast, right in the epicenter of rioting and protesting, where she's getting ready for the upcoming virus and all, various different uncertainties with her food storage right now. So check out that video today. All right, guys, we're gonna get started. We're gonna talk about herbs and viruses and all of that good stuff. Let's go. All right, so when we talk about herbalism, let me preface this with some of my experience. So I'm a family herbalist. I am continuing education. My end goal is to become a clinical herbalist. And so I'm constantly learning, constantly sharing, constantly evolving in herbalism. Let me just start this by saying that herbalism is not this one-size-fits-all thing. We don't treat herbs like drugs. Herbs are whole plants. Drugs are a minute portion of a plant. And so because we're using whole herbs to treat a whole body versus a piece of an herb to treat a piece of the body, we need to kind of think about herbalism in this way. So herbalism is a lot different from modern pharmaceuticals in the sense that when we use herbalism, we are treating the entire body, not just one symptom. So I'm going to give you a list of herbs, not just antiviral herbs, but herbs that will support your body during a virus, which I think is very important. Now, before you get started in anything herbalism, you need to consider your health. So do you have diabetes? Do you have heart disease? Do you have spleen issues, liver issues, things that could kind of interact with herbs, or herbs could interact with those things? Are you on certain medications? And I'm going to try to give you the contraindications of those different various obstacles that you could encounter with certain herbs. But for the most part, most of these herbs are safe to use for many people. Now, when we get started, we'll talk about just the herb, what it's good for, and then what kind of protocol you need to put into place. If you want specifics on dosage for each herb and how to use them, I have linked a blog post with all of this information that I'm sharing with you in the description of this video on my website, so you can get all of the details that you might need to confidently treat yourself and your family this year with herbs. So the first herb we're going to start with is Astragalus. I always start with this herb. This herb is one of my favorite. It has scientifically been proven to work with influenza and help build the immune system. Not only that, but heighten the immune system. So the way that Astragalus works is that you were to take let's just say you were going on an airplane and you wanted to heighten your immune system while on that airplane. So you would take Astragalus before you get on the plane, and it would help heighten that immune system during that time, and eventually throughout the day it would taper off. Astragalus does increase your white blood cell count, which kind of puts your body on alert that there's something going on or could potentially be going on. It's also a natural anti-inflammatory, and it works with the cardiovascular system. So it is very common in traditional Chinese medicine, and we enjoy using it here. I especially love making it in my elderberry and astragalus syrup, which that recipe you can find online. It is a powerhouse syrup for preventing and helping ease the symptoms of influenza, and we'll go over that in a second. Now, there are no real safety precautions that you need to know about with astragalus. but because it has such immune supporting properties, it is necessary to consider that it could interact with immune suppressing drugs. So if you are on something like chemotherapy, or if you have had an organ transplant and you're on an organ transplant drug, it could actually heighten your immune system. So those are things you need to consider before taking Astragalus. Chamomile is probably known most for being in a tea. In Western culture, it's a calming tea, but it has much greater benefits than that. Chamomile is a natural anti-inflammatory, antipeptic, so if you have some indigestion going on, it's antispasmodic, it's antibacterial, it has sedative actions. It does not put you to sleep, but it can ease you enough to help you go to sleep. It has a lot of great benefits other than just calming you. So we would use this herb to help calm you, to help relieve your body of stress, to help ease and relax your body during a virus. And the best part is there are no issues with chamomile. It's one of the most common herbs here in America. The only issue that you might run into is if you have a ragweed allergy. As with a lot of herbs, you might want to just be cautious. It's rare to have a reaction to chamomile, but it is possible if you have a ragweed allergy. The next herb I want to talk about is Chinese skullcap. Now this herb is a very powerful medicinal herb. So there are some contraindications with it, which we'll go over, but Chinese skullcap, not to be confused with American skullcap, is one powerful antiviral herb. In fact, it's one that should be used with caution, and unlike most of the other herbs that we're listing right now. So specifically, Chinese skullcap has been studied and proven to inhibit viruses, especially the 2019 novel virus, from attaching itself to our ACE2 receptors. So the way that the novel virus spreads is by attaching itself to your ACE2 receptors, and then it replicates there. Viruses, any virus, cannot replicate without a host. So that's why in a lot of situations you're told to leave packages on the front porch for a few hours. Viruses cannot replicate without a host, which is you, a living being. And so if you can inhibit any kind of virus from attaching itself to your ACE2 receptors, same concept, then it will not replicate in your body and cause issue. Chinese skullcap has also been applied in the treatment of dysentery, hypertension, hemorrhaging, insomnia, inflammation, and respiratory infections. So those are all secondary effects that could happen with any kind of virus, and so it's good to have that on hand. It's thought to have anti-cancer, liver protecting, antibacterial and antiviral, antioxidant, anticonvulsant, and neuroprotective effects. Chinese skullcap has helped heal bacteria like Listeria, E. coli, Salmonella, and Staph, and so many more. We use this herb to lessen the viral load in our body, or as a preventative in times when you know that you've come into contact with a virus-infected person. And so when we talk about herbs, I don't mean that you have to take all of the herbs all the time. That's not how the body works. But when you know you've come in contact with somebody who has a virus, or you know that you've gone out and you just kind of need to boost that immune system before you go or when you get home, these are the times to start your herbal protocol. As I mentioned, there is some safety information that you need to know about this herb. Do not take this herb longer than 2 weeks. Chinese skullcap should not be used when you are pregnant or breastfeeding under any circumstances. If you have liver or spleen issues, it's best to avoid Chinese skullcap. This herb can also interact and lower blood sugar. So if you have diabetes or you're on any type of blood sugar medication, you need to monitor that closely if you decide to take this herb. And as well, it can lower and slow the body's ability to create blood clots. So if you're on certain types of blood thinning medication or whatnot, or opposite, then that's something you need to think about. As mentioned, this herb can interact and enhance drugs that have sedating, blood sugar lowering, and anticonvulsive effects. So if you are taking any type of medication like those, you need to consider that this herb could interact with those medications. Echinacea is one of the most common natural antiviral herbs that you will hear about. You can say Echinacea and everyone knows what you're talking about normally. This herb is another fabulous immune boosting herb. Echinacea downregulates pro-inflammatory cytokines and upregulates anti-inflammatory molecules. So you hear a lot of people talk about cytokine storms with influenza and the most recent virus. Echinacea is a great herb to help downregulate those pro-inflammatory cytokines. And this also shows that the herb is beneficial with autoimmune disorders when facing illnesses such as the common cold. Those with ragweed allergies, again, should consider they could be reactive to Echinacea, though it is rare. And Echinacea can interact with medications that suppress the immune system, so consider that as well. The next herb we want to talk about is elderberry and elderflower. So a lot of people can't get to their elderberries before the birds get to them, so they might be interested to know that elderflowers have the same exact benefits as elderberry. A natural antiviral, elderberry and elderflowers became extremely popular after the H1N1 outbreak a few years ago here in the United States, when a study was released that elderberry had the ability to inhibit viral replication and effectively inhibited the virus from attaching to cells in the body. Flowers and berries of the plant also clean tissue and stimulate the digestive tract. For this reason, elderberry and elderflowers are a natural detoxification herb. Elderberry and flowers are well known to help lessen the duration of influenza, on average by 4 days. So if you want an alternative to Tamiflu, which most people by the time they go to the doctor, if Tamiflu is not going to work anyhow, elderberry and elderflowers, a homemade syrup, not over the counter, work best. It's also known to help prevent the influenza virus from attaching to cells, therefore it is a great preventative for seasonal flu. We take elderberry syrup, like I mentioned before with Astragalus, very frequently during cold and flu season, and it has helped us. We have not gotten the flu for years. One important note is that elderberry and elderflowers should not be used or used cautiously by people with autoimmune disorders, as it could worsen autoimmune diseases. The herb can also interact with immune suppressing drugs, though it's less common than some of the other herbs we've talked about. Elderberry and elderflowers are toxic until heated. That's extremely important to understand. It is ideally used in a syrup for this reason, rather than in teas or tinctures. I know a lot of herbalists make tinctures out of it or teas, but it can cause toxicity when created in an herbal preparation like that. Elderflowers may be less toxic than berries, but they still have some toxicity. Toxicity includes nausea and vomiting, which are generally not severe, but they have the potential to become more serious if you continue intaking the syrup or tea or tincture. Do not eat any part of the elderberry plant other than the berries and the flowers. Stems and branches and trunk of the bush are all toxic. The next herb we're going to talk about is garlic. Average, everyday garlic that you probably already have in your pantry. Garlic is one of those simple, everyday herbs that can be used for a multitude of things. It's a must-have in your kitchen when it comes to herbal cold remedies. Garlic has been used to help aid in digestion, infections such as dysentery, typhoid, enteritis, and cholera. It can be used in ear infection oils for UTIs and cold and flu symptoms. It can also be used as an antifungal for things like athlete's foot and ringworm. Garlic has a mild blood thinning ability that boosts heart health. It has been shown to reduce blood pressure in people with hypertension and promotes an overall healthier heart and cholesterol ratio. Garlic works hard to help fight bacteria, which is a must-have herb when confronting the possible secondary issue of pneumonia in any type of viral condition. Garlic should be taken at the onset of an illness as soon as it begins to help kind of combat that secondary problem of pneumonia that could arise. Garlic is best consumed raw, but it can be taken in capsules dried as well. However, if you chop it up and allow it to set for several minutes, it can tolerate heat without complete loss of its medicinal values. Do not take garlic if you are taking anticoagulant medications. Some sources suggest that substantial amounts of garlic should not be consumed prior to surgery as well, since it can prolong bleeding time. In rare cases, garlic can cause an upset stomach if eaten too much. Those are the only real safety precautions of garlic. The next herb we're going to talk about is a wild herb. Some of these already were, but we're talking specifically about goldenrod, which in my area at the making of this video is in abundance right now. So it's something that you can wild forage and something that I plan on wild foraging over the next couple weeks. While goldenrod is not a natural antiviral herb, it is a powerful respiratory herb. One of the most known abilities is to rid the body of excess mucus. Excess mucus can be one of the unfortunate side effects of recent and mutating novel viruses and other viruses. Antiviral herbs like goldenrod can help the body get rid of excess mucus in a heartbeat. This herb is also a natural anti-inflammatory, antimicrobial, and helps induce perspiration. This is a necessity when trying to sweat out a fever. For an exceptional throat gargle, you can combine goldenrod with sage in an infusion to soothe sore throats, thrush, and laryngitis. That's a hard combination to say. Goldenrod is also very popularly used to treat urinary tract infections. There are some safety precautions with goldenrod, though it's not very extensive. If you're doing irrigation therapy, you shouldn't take goldenrod while doing irrigation therapy because it can cause some, impaired heart and kidney function. Though rare, goldenrod has caused allergic contact dermatitis after both handling and oral administration. Those with ragweed allergies should exercise caution with goldenrod as they could be reactive. The next herb is lemon balm. In Germany, lemon balm is licensed as a standard medicinal tea for sleep disorders and gastrointestinal tract disorders. It has successfully been used for viral, fungal, and bacterial infections. In one study, lemon balm caused patients who have frequent cold sores to have a shorter outbreak with fewer symptoms. In a 2015 study, the herb was used to reduce heart palpitations and anxiety. For women who have menopause and those who simply have insomnia, a 2013 study showed that lemon balm combined with valerian successfully treated the insomnia in 81% of the women who took the remedy. Lemon balm is most effective as a mild sedative to help relieve tension and to help your body adapt to stress. So this is why we recommend it during viral infections to help ease your body and adapt to stress as much as possible. Lemon balm may interact with thyroid and anxiety medications, but that has not been proven, so typically it's considered safe. The next herb I want to talk about is marshmallow. No, we are not talking about the marshmallow that you buy from the store, specifically the herb marshmallow and the root of this herb. The Greek physician Hippocrates valued marshmallow as a wound treatment. Greek physician Dioscorides, I don't ever say that right, valued it in a vinegar infusion to help with toothaches and soothe insect stings. While still, herbalists through generations have valued this herb for its ability to soothe sore throats and coughs, heal inflammation, and urinary tract irritation and inflammation. Perhaps today the most common popular use of marshmallow is to help reduce coughing and inflammation in the respiratory tract. It is a common ingredient in cough syrups. Marshmallow also helps alleviate ulcerative colitis, enteritis, gastroenteritis, and peptic ulceration. Marshmallow helps stimulate cellular regeneration, and this is great when used externally as well. Marshmallow, however, is most commonly used to treat cough, especially a dry cough and any throat irritation you may have. Now, with other herbs that have a mucus type membrane reaction to your body, the herb has to touch the part of your body that is effective. So marshmallow, things like marshmallow and mullein that have a mucilage type effect, they have to touch the part of your body that is affected. So normally it's best to do a gargle or a drink. If you have any sore throat or respiratory issues, you can also take that and place it on your chest for any respiratory issues as well. So as far as safety goes, there are no known adverse effects of marshmallow. However, it can inhibit the absorption of some drugs since the herb coats the lining of the stomach, that mucousy membrane we're talking about. This is great for a damaged or leaky gut, but is not great if you're taking other medications. So take marshmallow several hours before or after taking your other medications. If you're on any other medications, it's not recommended to take marshmallow in a capsule form. Like I was saying, it has to touch the part of your body that's affected, unless you're taking it purely for laxative benefits. All right, we're about halfway through this list. It's a pretty extensive list, and if you don't want to finish watching the video, you can go just to the blog post and read the rest of it. I'm essentially reading my research from the blog post so that I can kind of get through this more quickly and not just dredge on. I want to give you all the information because a lot of you really enjoy this information, so that's why we're doing it. All right, the next herb I'm going to talk about is mullein. I do have a video coming out specifically about mullein in the next few weeks, but I also have a blog post strictly on it. In the late 19th century, a pharmaceutical trial showed that mullein was beneficial in cases of tuberculosis, like way amazing in tuberculosis. A doctor in Dublin, Ireland, noted that it was trusted popular remedy in Ireland for tuberculosis. The study stated that 6 out of 7 cases were successful in the treatment of tuberculosis by smoking mullein or drinking a mullein tea. The medicinal uses of mullein are far and wide, with extensive uses for tuberculosis and respiratory ailments affecting the lungs. Cultures have also turned to smoking mullein for cough and asthma, using the flower stalks as torches and as a medicinal earache cure when made into an infused oil were also not uncommon. Mullein has been proven to have anti-influenza properties, is an expectorant, and it eases sore throat and more. So mullein is something that you can forage for right now as well at the making of this video, and it's great in a tea. You can make a tincture. It's for antiviral properties, but it also has very much supporting type properties too. So if you have a sore throat, if you have bronchitis, pneumonia, and some type of respiratory issue, you can smoke mullein during that time just in a pipe. You can buy a pipe for $20 on Amazon and smoke it just like you would pipe tobacco. And you don't want to do it all the time. You just want to do it while you're sick, because any type of smoking can damage your lungs, but in this case, for a short period of time, it heals the lung lining. There are no known adverse side effects with mullein. However, it has been reported that mullein could interact with anti-diabetic drugs, so please consult your physician before taking if you are a diabetic, or if you just want that extra confidence that it's okay to take the mullein otherwise. The next herb is another common herb, and that's oregano. Yes, the oregano you have right in your pantry. The Greeks often made poultices with oregano and placed them on aching muscles, wounds, and bites, which is great if you have aching muscles or joints when you're sick. Since oregano is naturally antibacterial and can be used as a natural antibiotic, oregano has been used to treat illnesses and infections for centuries. In a 2017 study, oregano extract exhibited antioxidant activity and cytotoxic activity against breast cancer cells. In a 2016 study, it reduced the growth and viability of acute myeloid leukemia cells. Oregano has often been used in folk medicine to help control fever. You would need to accomplish this by frequently drinking large doses of oregano tea, not just the general 1 to 2 teaspoons. However, there is currently no scientific evidence proving that the herb itself can accomplish breaking a fever, but there is scientific evidence and some support that the essential oil can accomplish breaking a fever if ingested. So if the oil can do it, and we know that it scientifically can, then we know that the herb can as well. You would just have to drink it more frequently. Remember that when we're using oregano as a whole herb, we're getting the whole treatment. So the antibacterial properties, the fever reducing properties, all of it, not just one. Where the essential oil is much like a drug. It's still fine to take essential oils, but it can have some issues. Most of the studies done on oregano are for oregano essential oil, so just keep that in mind when you're researching oregano. The next herb I want to talk about is stinging nettle. This is another herb that can be wild foraged. Stinging nettle has been a respiratory support herb for centuries. It has been used for asthma, pleurisy, and for the treatment of spleen-related illness, and to protect the spleen during times of ailment, which is really important, especially with the most recent virus, because it's shown it can attack your spleen. In traditional African medicine, the herb is used as a snuff powder for nosebleeds, excessive menstruation, and to treat internal bleeding. North American Aboriginal medicines use it as an anti-rheumatic drug. In Germany, it is licensed as a standard medicinal tea for diuretic action. Modern clinical studies show the herb as an aid in allergic rhinitis, rheumatic complaints, acute arthritis, and again as a diuretic. It's also well known to support the urinary tract, often treating and preventing UTIs. We keep this herb around for respiratory support and spleen support during the virus. There are no known safety concerns with stinging nettle. However, it should be avoided during other irrigation therapies. The next herb we're going to talk about is sage. It's another herb that you probably have in your medicine cabinet, not your medicine cabinet, but your pantry. Sage is another herb that helps support the body during common viruses and ailments. It is best used to heal mucous membranes of the nose, throat, and respiratory tract. Use this herb in a gargle or dried in a tea for best efficacy in treating the respiratory tract. It is not recommended to use sage while pregnant or breastfeeding. The pure essential oil and alcoholic extract should not be used at all internally during pregnancy. After prolonged ingestion of alcohol extracts or of the pure essential oil, there can be other side effects like epileptic type convulsions can occur. It's rare, but it's something, I don't want that to scare you from using sage. We're talking about very prolonged use of high medicinal doses of sage. So just keep that in mind. We can use herbalism, but we have to do it safely as well. The next herb is thyme. I love thyme for cooking. I cook everything with thyme. One of the most common herbs in your pantry. Thyme is a natural antiviral herb, but is also an incredible support system for an already ailing body. According to the Commission E, it's approved for symptoms of bronchitis and whooping cough and catarrhs of the upper respiratory tracts. That means excessive mucus pockets. It has also been used to improve digestion, to treat pertussis, stomach issues, and halitosis. Thyme is a natural flatulence release. It's a natural antibiotic. It treats parasites. It's astringent. It's an expectorant, and it relieves cough. It's very common in cough syrup. This herb is best taken internally in a tea infusion when treating coughs and respiratory ailments. There is some safety precaution around thyme, mostly the essential oils. Thyme essential oil can be extremely toxic. The whole herb is preferred when being used internally. Signs of essential oil thyme toxicity escalate from nausea to respiratory arrest. Thyme is not recommended in medicinal doses during pregnancy. The next herb I want to talk about is yarrow. I do have an entire video on yarrow you can check out, so I'm just going to hit the very basic points. Yarrow has traditionally been used as a tonic, anti-inflammatory, antispasmodic, diuretic, and it stimulates blood flow to the pelvic area. It's also been extensively used for pneumonia, rheumatic pain, and for wound healing throughout history. We've also used it for malaria, jaundice, liver disorders, and it's a very well-known hepatoprotective herb, which means it protects the liver. We have even studies done where yarrow is used in the prevention and treatment of influenza, though there aren't really a ton of studies about it treating influenza. It has been speculated in studies that it can treat it at the onset of symptoms. Yarrow can also be used as a mild sedative. Some safety concerns with yarrow: do not take yarrow if you are pregnant, as it can cause uterine contractions and may result in miscarriage. If you are on high blood pressure medications, please note that yarrow can lower blood pressure and therefore your regular blood pressure medications could be affected. Placing yarrow on the skin can cause issues if you will be immediately in direct sunlight right after you place it on your skin. Yarrow is a fabulous herb. I think everybody should be growing it and using it and keeping it in their pantry. It has way more other benefits than what I just mentioned. So check out the video that I put together. And if you don't want to watch a video, you can check out the blog post I have for yarrow. Now that's it for my list of herbs. I do want to make a couple of notes. I want to talk about a little bit the novel virus and one important thing that's not an herb but is essential oil related. And then I wanted to kind of help you put together a protocol on how to use these herbs. So just a note on the novel virus, the 2019 virus. While this article and this video aren't about the 2019 virus, though we do mention it, I do want to link a study that shows where lemon and geranium essential oils can inhibit the virus from attaching to ACE2 receptors. This is how the novel virus replicates and spreads throughout the body, as I mentioned before. You can find the study in the blog post that I'm linking in the description of this video, where you can also find all of the other information from this video. In this study, they found that the treatment with the lemon and geranium essential oil significantly downregulated ACE2 receptors expression in the cells, and the results suggest that these oils and their derivative compounds are valuable natural antiviral agents that may contribute to the prevention of the invasion of the virus into the human body. So I just wanted to link to that because I felt like that was really important, and those of you who love research might find that research handy as well. Okay, now that we have all of this information, we've listed our herbs, we've talked about a couple of the oils in the study, Let's talk about how to put your protocol together. Now, we have all these herbs, and I don't want you to take all of these herbs. Don't do all of the herbs. I wanted to give you a fairly exhaustive list of herbs so that you could pick and choose what you want based on your body, your lifestyle, and what medications you might already be taking. Not everyone is perfect, not everyone is healthy, and so we understand that. So I wanted to give you some options on what different things you could use. So here's what you're gonna do. You're gonna choose one herb of each of what I'm about to list. You're gonna choose one herb for immune preventative support, like astragalus or elderberry. Another herb for immune support after a virus begins, like the Chinese skullcap or the elderberry. A fever reducer, like the mentioned oregano and so on. A cough reducer, a respiratory support herb, a liver protecting herb, especially during certain viral infections, and if you insist on taking over-the-counter pain relievers and fever reducers. Over-the-counter drugs like that will attack your liver. So it's important to find a liver protecting herb along with this protocol so that you can take that to protect your liver during a viral time. And choose an herb for secondary condition support. Things like pneumonia that could occur. Oftentimes, not even with the newer virus, but with influenza, people don't necessarily die from influenza, just like measles and the measles virus. People don't die from measles. They die from pneumonia. So you want to find an herb, one of the herbs I listed, to help support your body so that secondary conditions like pneumonia do not occur. Once you've chosen your herbs from the list above, the list that I've given you, one of each, you can store them away in your cabinet or pantry for whenever you might need them, or you can create an herbal preparation like a tincture or a syrup or a tea blend. Tinctures take up to 6 weeks. Syrups can take a few hours. So make these things in advance, you know, now, September-ish, October-ish, so that you have them on hand when you really need them. All in all, using herbs is about constant and diligent care. Using preventative herbs to prevent a virus from ever happening is going to be your best bet. But then once a virus occurs, you need to diligently and consistently drink your teas, take your tinctures, take your syrups every couple of hours, because herbs do not work like modern day drugs do. They do not stay in your body, in your system for hours and hours and hours like drugs do. They are so whole that your body knows how to digest them and break them down because they're a whole herb and a natural plant. So your body is more welcoming to that process. Modern day drugs are not like that. Your body has to fight off that drug and absorb that drug for hours and hours and sometimes even days after you take it. So there's a big difference between treating herbally and treating chemically. And so I wanted you to know that before you start your herbal protocol, before you jump headfirst into herbalism and say it doesn't work, it doesn't work. I do also want you to exercise caution if you have any secondary or pre-existing conditions. Make sure you do all of your research on your herbalism to see if they can interact with medications or other health conditions you might have. And when making tinctures and syrups and oils, make sure you are measuring always by weight, not just a dash here and a dash there. If you're going to make herbal preparations, which you can find some of this on my website, make sure you're always doing a weight by volume ratio so that you know the syrup or tincture is the same every single time you do it, and you can properly dose yourself during that time that you need it. All right, guys, like I had mentioned, all of this information is in the description below. You can find it on my website. Don't forget to check out Anne's video. She is talking about being on the West Coast and stocking up her pantry this year, and I think it's really important for you to go check that video out along with my video I did a few weeks ago, if you haven't seen it already, where we're talking about just food storage and preparing for fall and winter with the novel virus. Thanks for joining me, guys. Don't forget to subscribe, and as always, happy homesteading.